Hello, today we're going to look at all the things that can go wrong when you take metformin and how to avoid them. And unfortunately, doctors won't tell you these things because they just don't have enough time to do it. We'll also look at some other ways to lower your blood sugar with fewer side effects. So what is metformin? Metformin is a type of medicine that you swallow that helps to lower your blood sugar. Some doctors may prescribe it if you have pre-diabetes, where your blood sugar is higher than normal, but not high enough to be in the diabetic range. But once your blood sugar goes up into the diabetic range, in many parts of the world, metformin is the first medicine your doctor will prescribe. So let's talk about the most common side effects of metformin. Seeing as metformin is a medicine that you swallow, you're going to get a lot of side effects in the gut. So you might have nausea, vomiting, stomach pain, and constipation. You may feel very gassy and bloated, so you find yourself burping and farting a lot. You may get an unusual taste in your mouth, which some people have described as being metallic, and some people even lose their sense of taste. But one problem in the gut that people find really disturbing is explosive diarrhea. And it can be so bad that some people won't take metformin if they're going to leave the house, so that they don't have an accident away from home. And up to 50%, that's half of people who take metformin, may have some degree of diarrhea. All of us have lots of different bacteria in our gut. Metformin can change the balance of these bacteria in the gut, which can lead to diarrhea. This can also happen to people sometimes when they start eating only meat, like with the carnivore diet. Another side effect you might experience is general weakness and also muscle pain. Normally, when you stand up from a seated position, your blood pressure increases a little bit to make sure that there's enough force to carry blood which contains food and oxygen to your brain. If your blood pressure doesn't increase when you stand up, you'll feel dizzy and you might even faint and fall. This is called postural, that's related to your posture, your position. Hypotension, that's low blood pressure. And this is one of the side effects of metformin. It's a big problem, especially in older adults who may already have problems maintaining balance. And falls can lead to head injuries and broken bones, and many never completely recover from these injuries. Some blood sugar lowering drugs like Amaryl and Dionyl commonly cause very low blood sugar. That's what we call hypos. Metformin rarely causes hypos, but it can in some situations. Like if you take metformin without eating, if you're using it combined with other drugs that lower blood sugar, if you do vigorous exercise after taking it, if you drink a lot of alcohol while you're taking metformin. Metformin can reduce absorption of some vitamins and minerals from your gut. These include B12, folate, and calcium. These deficiencies may develop within a few months of starting metformin, or you may take metformin for years before you notice anything wrong. B12 helps your brain and nerves to work properly, and you also need it to make healthy red blood cells. Symptoms of lack of B12 can include feeling very tired, loss of feeling or tingling in your hands and feet, or even pins and needles sensations. You may also have problems remembering things, and a lot of the signs of not having enough B12 are similar to what you might see if you have diabetic nerve damage. So it's important to find out about this B12 deficiency as early as possible, because after some time the effects can't be reversed. Some of the less common side effects of metformin include chest pain. You may get infections of the nose and throat more often. You may also have a dry cough that just refuses to go away. You may also start sweating heavily, and you may have frequent headaches. So let's talk about some of the rare side effects of metformin, and one of them is lactic acidosis, which can be life-threatening. Symptoms and signs include nausea, vomiting, diarrhea, tiredness, muscle pain, shallow breathing, and you may be so confused that you might not know who you are or where you are and what time of day it is. You're more likely to have lactic acidosis if you're elderly, if you're using a high dose of metformin, if your kidneys aren't working properly, if you have an infection, and if you're drinking a lot of alcohol while you're taking metformin. Also related to lactic acidosis, another area where you need to be careful when you're taking metformin is when you're doing certain x-rays and CT scans. For some of these investigations, you may need to be injected with a contrast medium containing iodine. What this contrast does is that it highlights certain parts of your body, like your urinary tract. And if you have decreased kidney function, you may have to stop taking your metformin before you do these tests. The trio of decreased kidney function, the contrast medium used for the test, and metformin together increases your risk of developing lactic acidosis. But your doctor will know how to advise you if these types of tests are ordered for you. Another very rare side effect is serious allergy to metformin with symptoms like rash, swelling of the lips and tongue, or difficulty in breathing. And just like lactic acidosis, this needs emergency treatment. Some people have complained about damage to the kidneys from taking metformin. Metformin isn't known to damage the kidneys and the liver, but remember that metformin is treating signs of diabetes like high blood sugar, but it's not solving the underlying problem, the root cause that's causing these signs in the first place. So over time, you might start having problems with your kidneys as a side effect, a complication of diabetes, and not necessarily from taking metformin. But of course, where the human body is concerned, anything is possible. Metformin works in your liver, and it's removed from your body through your kidneys in your urine. So if you have liver or kidney problems before you start taking metformin, your doctor will be monitoring you, giving you more frequent checkups, and would also adjust the dose of your metformin based on your lab results, or even put you on a different type of medicine altogether. So the big question is, if we know that metformin has these side effects, why do we keep prescribing it? First of all, every medicine has side effects, even the pain medicines and the ones we take for a cough and a runny nose that we buy freely without a prescription. If your doctor thinks that the benefits of taking metformin are more than the risks, then it will be prescribed for you. If you have a headache and I prescribe a medicine that cures your headache but makes you blind, then definitely the benefit there is not worth the risk. So we look at all these things. Metformin has been used for decades, so we understand how it works. We know what to expect when we prescribe it. Metformin is cheap, and many of the newer diabetes drugs are very expensive, and you may not be able to afford them, or they may not be covered by your health insurance. Another thing is that you take metformin as a tablet or a liquid, so there are no needles or injections involved. Some diabetes drugs make you put on weight, but metformin doesn't, and you may actually lose a bit of weight while you're taking it. So what can you expect when you start taking metformin? When you start taking metformin, yes, you might get side effects, but there are a couple of things to keep in mind. First of all, the higher the dose, the more the side effects. Second is that you may not have any side effects at all. There are people who've been taking metformin for over 20 years and they're perfectly fine. And then you may have some side effects, but they become less over time. And then they may come up again when the dose of metformin is increased. And then when your body adjusts, then the side effects subside again. And then you might belong to the group of people for whom metformin just doesn't work. And it doesn't matter what you do to try and minimize the side effects. You just can't tolerate it. So how do you prevent the side effects of metformin? First, start gradually. One of the best ways to avoid side effects with metformin, especially if you've just started taking it, is to start with a very low dose, what we call slow and low. That would mean starting with 500 milligrams at night. Taking it at night means that you might be able to sleep through any discomfort. After a week, then you add 500 milligrams in the morning, and then slowly increase the amount and frequency until you reach the required dose. Your doctor can switch to the extended release form of metformin. When you take the regular metformin, it kind of goes into your blood almost all at once. The extended release version is released in small amounts over a long period of time, so it usually has side effects. Another thing is to never take metformin without eating food. Wait at least 15 minutes after eating before you take it. This will reduce the nausea, the stomach pain, and side effects in the gut. You might also want to avoid very spicy food and dairy products. We can make the stomach upset and diarrhea worse for some people. Your doctor will check your B12 levels regularly and may recommend supplements if they're dropping too low. If you find that the side effects of metformin are just too much for you to handle, your doctor may prescribe a different medicine for you. And this will depend on your own specific needs, how high your blood sugar is, and any other health conditions that you might have at the same time. So some of the drugs that might be prescribed include Amaryl and Dionyl, Jardiance and Invokana, Ozempic, Trulicity, Januvia, and Tradjenta. There are several supplements that are well known to lower blood sugar, and I'll just mention a couple of them. Remember that if you're taking blood sugar lowering medicines, you have to make adjustments with the help of your doctor to stop your blood sugar from dropping dangerously low. Berberine is one of the most well-known supplements for lowering blood sugar. It works a lot like metformin, and it may also help to lower triglycerides and your blood pressure. The usual dose is 500 milligrams 2 or 3 times a day. Inositol belongs to the group of B vitamins. People with high blood sugar tend to have low levels of inositol. So inositol helps the insulin in your body to work better, which lowers your blood sugar